Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to ZB Medical Lectures. Today I am going to discuss about fever. Before starting, please do subscribe my channel and press the bell icon. At the end of this lecture, you will be able to know what is fever, mechanism of fever, types of fever, and pattern of fever. Now fever. Any body temperature above the normal of 98.6 Fahrenheit or 37 degrees C. In practice, a person is usually not considered to have a significant fever until the temperature is above 100.4 Fahrenheit or 38 degrees C. नॉर्मल बॉडी टेम्परेचर हमारे पास 98.6 फ़ारेनहाइट और 37 डिग्री सी है. जब इससे बॉडी टेम्परेचर ज़्यादा हो जाए तो हम कहते हैं फीवर है. बट यूजुअली इन प्रैक्टिस हम फीवर को सिग्निफिकेंट फीवर नहीं कंसिडर करते जब तक बॉडी टेम्परेचर 100.4 फ़ारेनहाइट और 38 डिग्री सी से अबव न चला जाए. जब बॉडी टेम्परेचर 100.4 फ़ारेनहाइट और 38 डिग्री सी से ज़्यादा हो जाए, then we consider to have a significant fever. अच्छा फैक्टर्स. अच्छा फीवर के क्या क्या फैक्टर्स हो सकते हैं? फीवर कैन बी कॉज्ड बाय इन्फेक्शन, इन्फ्लेमेशन, न्यूप्लाज्म, trauma. These things can give you fever, so keep them in mind. You can always make your differential based on those four things. Now mechanism of fever. When an infection, inflammation, trauma or injury occurs, first host defense mechanism is activated, such as leukocytes and tissue macrophages. These leads to cytokines production such as interleukin-1, interleukin-6 and tumor necrosis factor. These factors act on the hypothalamus, and hypothalamus causes the production of prostaglandins E2, increases the set point of hypothalamus and activates the mechanism of vasoconstriction, piloerection, epinephrine secretion and shivering mechanisms. These all mechanisms then lead to increased body temperature. Now classification of fever. Number first, based on duration, you can have acute fever, subacute fever and chronic fever. Number second, based on height of body temperature. It means how high the fever can goes. You can divide it into different categories such as low grade fever, moderate fever, high grade fever and hyperpyrexia. Now first of all, acute fever. The acute fever is usually less than 7 days and it is seen in upper respiratory infection, viral upper respiratory infection and malaria. So subacute fever less than 2 weeks and usually seen in intra-abdominal abscess or typhoid fever. Chronic or persistent fever greater than 2 weeks. Always keep in mind TB, HIV and cancer and also connective tissue diseases. Now hyperpyrexia. The extreme of temperature is hyperpyrexia, which is greater than 100.6 which is greater than 106 Fahrenheit. Hypothermia less than 97 Fahrenheit. So keep these temperature in mind. When you see such a high fever, keep in mind that it's not usually an infectious cause. Think of something else than infection. So what are the sum of non-infectious causes that you can keep in mind are drug fever, heat stroke, malignant hyperthermia, center fever, malignant neuroleptic syndrome and HIV. So when we establish for probable cause of fever in a patient, we look for 4 important clues. We can look at the clinical picture, how they present it. The labs help us. How does the patient look? Does he look too good for a fever, or does he septic or toxic? The fever pattern and fever magnitude, like how high the fever goes and what's the pattern of fever is. Now something about fever pattern of fever were used in the past and they have been used for many centuries to actually tell a clinician what are the possible differential for this fever pattern and all the it can be helpful in infectious diseases, but certain infectious they are likely typical for producing a specific pattern. If you see a pattern, you know that it could be this infection, so certain infection definitely give you a specific pattern and that can help you to come up with the differential diagnosis, especially in the scenario when the fever is the only thing that a patient present with. There is no localizing signs and the pattern of fever itself can tell you the differentials. So three major pattern based on frequency of fever. There is a continuous fever, intermittent fever, remittent fever. So we will talk about the major pattern and then we will also talk about the fever pattern which are other fever pattern which are very interesting. There is a step ladder fever, relapsing fever, biphasic fever and inverse fever. Now look at the pattern. The dotted lines are considered that as a normal temperature. There is a spike every day and the temperature is above normal every day. So patient started from low grade fever, went up and then he is stay above normal. It is continuous fever pattern. So they started low grade fever and then they leave at this high temperature throughout the duration of the illness and they don't come back to the normal. The daily elevated is 100.4. Fluctuation of temperature is 0.5 in 24 hours. Temperature remains above normal throughout the day. And so remember, the temperature does not touch normal baseline at any time. So the common diseases associated with this kind of pattern is or central fever, drug fever, lobar and gram-negative pneumonia, rickettsial disease, acute bacterial meningitis, nosocomial infection of IV lines. So keep this in mind when you see continuous type of pattern. So this pattern, so they have a fever spike day 1, but then on the same day comes back to normal. Then they have a fever spike again, comes back to normal. So keep having a fever and then it always come back to normal within the 24 hours. So this is called intermittent fever. Wide fluctuations present only for several hours, as you can see in graph during the particular days. So in a day the fever is present for several hours. Elevated 100.4 Fahrenheit. Usually there is no temperature in morning, but then it peaks in afternoon. The basic thing about this fever that it return back to normal at least once in a day. Now, what diseases are associated with this particular fever? Or abscess, endocarditis, TB, schistosomiasis, leptospirosis, Kala-Azar. So remittent fever, if you can see the graph, on day 1 they started out normal and then they spike and come back sort of close to normal but not normal, and then spike again, come back close to normal. So that's the remittent fever. Fever with daily fluctuation exceeding 2 degree Fahrenheit, wide swing in temperature. There is a wide fluctuation like intermittent fever. The temperature remains above normal throughout the day and it does not touch the normal baseline at any time. In intermittent fever the temperature come back to normal, but in remittent fever it does not touch the normal baseline at any time. So the diseases associated are many viral infections, infective endocarditis, acute rheumatic fever, Kawasaki, rickettsia, brucellosis, Legionella and mycoplasma. So you can see the difference between remittent and intermittent in this graph. They spike a fever, but they never come back to normal. With remittent, you can see the orange line over there, whereas the intermittent come back to normal. Now let's talk about the other types of fever. So relapsing fever, fever relapse every 4 to 14 days, repeating the same cycle. So they have fever in the same kind of range. They become afebrile, and then then the fever again. So it keep relapsing. The relapsing fever can have infectious as well as infectious causes. Most temperature elevation in relapsing fever are at night, and there are certain types of relapsing fever as well. So interestingly, you can see in the graph they have fever for several days, and then they back afebrile, and then fever spikes again. So like they will have fever for like 4 to 14 days, then afebrile for a period of time, then again fever. So stepladder fever, usually seen in typhoid fever, and it is very classic for it, that they have temperature rise and it goes up, and then there is a high level with every spike. So started from 100.4 to 101, then 102, then 103. Like they have ladder type of pattern. If you can see in the graph, they start out and they keep climbing up. They don't stay one kind of temperature range. They just develop like higher fever. And once they have appropriate therapy, it just gradually comes down in a step ladder fashion as well. Now, Phillips-10 fever, it is based on the names of the two physicians who found this type of pattern, in particularly in lymphoma patient, in Hodgkin lymphoma patient. It's a daily high-grade fever for about a week, then they have a low-grade fever for the next week, and then so on. So they keep having this pattern where they have about 3 to 10 days of fever, high-grade fever. Then they become afebrile, and then they have the same pattern again. It is very typical for Hodgkin lymphoma. The cause of this kind of pattern is the cyclic release of the cytokines, and in the lymphoma patient, lymph node necrosis along with the damaged stromal cells. So this is all about the fever. Thank you so much for watching this video. Let me know in the comment box about the next topic, and please do like, subscribe and press the bell icon.